Welcome, everyone. Thank you so much for joining us. All right, I think we're going to go ahead and get started. Well, thank you again for joining us. We're honored to have with us Dr. Joon Lee, the lead provider and founder of SeeBeyond Medicine. The Dr. Lee is triple board certified physician in family medicine, integrative holistic medicine, and obesity medicine, and she brings more than 2 decades of expertise to her work. Her clinical skill set extends into functional medicine, integrative oncology, hormone therapy, and stem cell therapy, and of course, much, much more. What truly sets Dr. Lee apart is her unwavering dedication and commitment to supporting her patients with the most comprehensive and innovative evidence-based therapies available, which is why we are so excited that she is now bringing TMS therapy into our practice. This advanced treatment expands the scope of care we can offer, so providing new possibilities of healing, mental wellness, and holistic support. Please join me in welcoming Dr. Joon Lee as she leads today's discussion on deep TMS therapy.
Hello, everyone. Good evening. Thanks for being here. Before I start, thank you, Yvette, for the grand introduction. Before I start, I want to acknowledge one special guest. Perry Giddens is my psychiatric nurse practitioner friend who's gracefully accepted to join this talk. He's a well-experienced psychiatric nurse practitioner who's been doing geriatric psychiatry, acute and general care psychiatry, substance abuse and addiction recovery, as well as pediatric and adolescent psychiatry. He is well versed in CBT, DBT, talk therapy, collaborative problem solving, as well as has been a TMS practitioner for the last 2.5 years. He has a TMS practice, so I welcome Perry to the talk to add on to any of his expertise that he can add on to this talk. So thank you for joining us, and thank you for everybody who's taken the time to join this talk today. All right, let's talk about TMS. So the learning objective for tonight is really to understand what TMS is, who TMS can help, and understand the treatment efficacy and the side effects of TMS with comparison to antidepressants and talk therapy, and what to expect during a TMS session, and why our approach at SeeBeyond to TMS is a little different. All right, go. So what is TMS? TMS stands for Transcranial Magnetic Stimulation. It's a non-invasive, gentle outpatient treatment to stimulate our brain. The magnet is up here, and it's applied to the scalp, and it shoots electric currents into the brain to stimulate blood flow and electrical pulses that wakes up the brain, basically. It's well known for its treatment efficacy for depression, anxiety, OCD, PTSD, and it's been expanding into migraine, nicotine use disorder, and anxious depression. Its FDA-cleared indications are right here, and you can see each year the diagnosis seems to be expanding. So, our brain, when we're thinking about some stuff, emotions and thoughts are regulated by two systems. One is chemistry, and the other is electricity. When I say chemistry, I mean neurotransmitters, and they're different inhibitory neurotransmitters and excitatory neurotransmitter that regulates our thoughts and emotions. Serotonin, which is very well known because most of our antidepressants are serotonin reuptake inhibitors. And we've been throwing antidepressants at depressed patients for years since Prozac was invented in 1987. We've been neglecting to see that brain is also a dynamic organ that has electrical pulses going on. These are neurons, and when we practice a certain thought or emotions, these neurons create brain pathways that strengthens over time. So if you're a happy person thinking about happy thoughts all the time, that pathway gets strengthened. If you are a sad person thinking about sad things all the time, then that pathway strengthens. And TMS can actually tackle this electrical system, which is quite exciting. And if you look at a functional PET scan of a typical brain, The gray matters are all lit up and the limbic system is lit up. Gray matters are where our cognitive function happens, and limbic system is where our emotional regulation happens. And in the depressed brain, you can see that the light switch is kind of off, it's dimmed out. So I wanted to sort of explain how our emotions and how our brain pathways work with a Disney movie that I love. It's called Inside Out. My patients might have heard me talk about this movie once. I'm going to play a very short clip. It's about a minute. Enjoy the movie for a minute, and hopefully, it helps you to understand how our brain works. A move across the country, and more centrally, how five emotions, joy, the leader, sadness, fear, disgust, and anger, balance the control of her mind from a mission control like headquarters. In this model, each day consists of discrete moments colored by one of the five emotions, which are sent during sleep to a vast archive of long term memories. Very rarely, an experience is so formative that it creates a core memory, which goes on to form the basis of Riley's personality, imagined as theme park islands. When joy and sadness are accidentally ejected from headquarters, the film chronicles their cathartic journey through several other mental regions, including Imagination Land, a dream production company that looks like the Paramount lot, abstract thought, and a subconscious jail. Okay, hopefully you guys enjoyed that a little clips. That subconscious jail where the light turns off and becomes really dark, that's probably the place of depression. And what TMS does is it lights it up. The reason why we chose deep TMS versus the figure eight coil, which was the original invention by Anthony Baker in 1985, is because figure eight coil, you have to hold on to it and it really depended on the practitioner's preciseness to target the brain. Whereas the deep TMS, it's deep and broad, so it's a lot easier to brighten up the brain with the ease of the helmet. So it's a hands-off approach. It's easier on the patient, it's much more comfortable, and it's easier on the TMS technician because it's changing the blood flow and the metabolism at the stimulus site much deeper and much broader. It is also the first to get FDA approval in OCD. I forget exactly what year, but I think it was 2 years before everybody else in 2018. And other devices,
2018.
yeah, thank you.
Yeah.
And then
And
I
it was
think
the only
other,
one that actually got the OCD based on proven study. The other ones failed all their studies.
I think other devices are started to get it in 2020, right?
Right.
And then I think it's also the first to get FDA approval on nicotine use disorder. Um, and the final thing that made me choose Deep TMS over figure eight coil was their helmet is labeled H1, H7, H4. And when I asked what that H stood for, Maoz, who just spoke, his
Mhm.
answer was it was Hesed by Hebrew, which is God's unfailing eternal love and enduring kindness. And they had me at that.
It means compassion. Yeah.
Yep, being compassionate and being helpful and being kind matters a lot here. So we're deeply committed. And one of the reasons why I was really drawn to TMS was because it was beyond just brain effects. So yes, it does change the brain neurotransmitter concentration and it upregulates serotonin receptor. Same concept as serotonin reuptake inhibitor, but that's chemistry. This is upregulating the receptor so that you can receive more of the chemistry. It has an effect on local GABA, which is a turn off switch that helps you to go to sleep. But it also has an effect on local glutamate, which is a turn on switch that helps you to focus. Beyond the brain, it has an endocrine pathway effect because our brain, at the end of the day, is a control center that controls all the endocrine pathway from hypothalamus to pituitary to adrenal axis. Cortisol axis are regulated by the brain, um, as well as thyroid. So hypothalamus, pituitary, thyroid axis is also affected by the TMS. So I was quite excited when I heard TMS can increase energy in chronic fatigue syndrome, as well as my Hashimoto's and hypothyroidism patients. Not only that, it doesn't stop there. It upregulates the neurogenesis gene, which is Neurotrophic effect, for those of you who are wondering what's neurotrophic, it means you're generating new neurons, new brain cells. That's quite exciting because as we age, our brain atrophies and our brain shrinks. But TMS increases gray matter, which is where cognitive executive function exists, and it increases hippocampus volume, which is the limbic system where learning, memory, and emotional regulation happens. And then lastly, but most importantly, it changes the connectivity of the neuronal circuit and it increases neuroplasticity. That means we're more flexible in our thinking. We're more adaptable. We learn new things faster. So that all of that were very attractive to us. So all these TMS effects makes you want to try, and everybody um, probably is excited to hear that FDA is starting to broaden the therapeutic applications, but there are many off-label indications out there. So I kind of researched some of the scholarly articles and tried to rank this by strength of evidence. And obviously, some of the psychiatric illnesses are here, um, but I'm particularly excited to see that it can treat addiction, alcohol, eating disorder, overweight patients. Um, it's treating schizophrenia with negative symptom makes sense because that psychomotor retardation, it just wakes you up. PTSD, new circuit of thinking, new way of paradigm, new ways of thinking. But chronic pain syndrome, fibromyalgia, diabetic neuropathic pain, those are really exciting to me. Migraine headaches are really exciting to me. Particular interest of mine would be dementia prevention, dementia treatment, mild cognitive impairment, cognitive disorders. If TMS can boost our IQs, I'm in. I'm going to try that and I'm going to try it. There's robust research articles on post-stroke rehabilitations, especially in a subacute phase that's less than 6 months. It helps with upper limb spasm as well as lower limb spasm. It helps with speech restoration. Those are very exciting news. Those are for our geriatric patients, but also for our children. It helps with focus, ADD, ADHD, pervasive developmental disorder, and autism. Movement disorders such as Parkinsonism and Tourette syndrome can be helped. Traumatic injury and chronic tinnitus can be helped. So I put this cartoon figure here, brain running on a gym. So I kind of want to think of TMS as just stimulating the brain, tightening up the muscle, and increasing that practice of just getting stronger and more focused and strengthening certain pathways that are going to make us feel happier and well. So who can get TMS? It used to be mental disorders only, and it used to be psychiatrist's office only. It's rapidly spreading into other realms of like movement disorder, multiple sclerosis, fatigue. The age has even lowered down to greater than 12 years old. It used to be only adults. So excited to see that it could help children as well. And then I'm particularly interested in the anti-aging longevity world where TMS is used as a wellness care. I think everybody can benefit. All right, so then we should talk about why is it not for, why isn't it then it's so popular that it's for everyone? I think some of the myths and barriers of TMS is that people mistakenly confuse TMS as ECT. ECT is electroconvulsive therapy. It's FDA approved for psychotic depression, catatonia, and acute suicidality, much more acute and severe mental disorders, which requires hospitalization. It's quite painful, so it requires anesthesia. And this must be done under the supervision of psychiatrists. And there's serious side effects like memory loss and confusion that comes with electroconvulsive therapy, which is different than TMS, which is FDA approved for treatment-resistant depression and is used in many other non-FDA cleared indication. And it's observed and standardized as safe outpatient treatment. It's very easy to administer by a certified TMS technician. I'm particularly proud of our Sarah, who's been really training hard, visiting other TMS clinics, and really heading all this TMS treatments at this time. And she learned it really fast. And I could see her learning curve going up like every day. There's really no systemic side effects. There's no cognitive side effects. You can drive to your appointment and you can drive back home. It's not invasive, it's not painful, and it's expanding into primary care and wellness practices like ours.
If I
And it's
can add
really,
something real quick,
mm-hmm.
the head of neuromodulation at Harvard, Dr. Morales, in the past, who ran their ECT, shifted to TMS and left ECT altogether for multiple reasons. But one of them is TMS is obviously very, very easy treatment, very light, no need for anesthesia, and the relapse rate with ECT is extremely high, while here the length of the recovery is quite long. So, from all those reasons, it was much more beneficial.
Yeah, as we do more of the TMS sessions, we see how easy it is. I've tried it. I was like, oh, let me try this. If it's going to increase my IQ, why not? And with the first session, I have to say, my sighing rate, I was sighing a lot when I got worried about certain things, got much less, and I was baseline happier, a little bit happier, and it was
You know,
great.
it
Um,
generally increases cognitive ability and concentration levels. It's
yeah.
like a gym for the brain. So when you put on the treadmill, I like this. I like that image.
I know that little cartoon was really cute, right? So, TMS evidence for depression is pretty good. When you're doing talk therapy, I like cognitive behavior therapy the best, so I put it in there. I think it's the most effective. Remission rate is 2 out of 3 patients. Long-term outcome is superior when it's combined with the antidepressant. Um, Antidepressant, however, remission rate is really only 1 out of 3 patients. Most do not achieve remission. And as you try more medication, the remission rate actually goes down. So first medication remission rate is 32.9, second medication 29%, but third medication remission rate is 10%. So likelihood of achieving remission decreases with each subsequent failed treatment. And relapse is much lower if full remission is achieved with one medication, the first medication. But antidepressants are hard, like it's trial and error, and you feel a little bit better, but you're not sure, and then you become like tolerant to it. That's been my experience with my patients. Um, TMS, however, the remission rate is much greater. It's 1 out of 2 patients. 56% is what's cited in the STAR-D study, I believe. And the meta-analysis that was done in 2024, that looked at 18 trials, concluded that TMS is 5 times likely to remit in comparison to antidepressants. And what I love about TMS, because I want everything done fast, the rapid response rate is really wonderful. I mean, the first treatment definitely made me feel better. All righty, here we go. So head-to-head comparison of antidepressant to TMS. Antidepressant, a lot of patients end up stopping because there are some serious side effects they just don't tolerate. We usually end up using 2 or 3 medication, and we have to worry about drug interaction and serotonin syndrome. That's too much serotonin. And over time, treatment resistance happens, takes 4 to 6 weeks to feel better. And a lot of my patients quit after 3 weeks saying it doesn't work. There are certain withdrawal symptoms that you have to worry about if they quit and stop rapidly, abruptly. And then there's a high risk of relapse on people who stops. 1 out of 2 patients end up relapsing. Whereas TMS is safe because it's focal, it's right there, it's just the brain. It's temporarily like minimal side effects that you experience. It's quite effective. It's like who failed antidepressant should do TMS is what the insurance companies say, right? So studies show a significant portion of patients who's already failed antidepressant still respond to TMS, with some achieving full remission. Faster onset, we talked about in a couple of days, you feel better. Even if you just stopped, there's no withdrawal symptoms, and there are maintenance treatment that can prevent relapse. I think of that as like if you went to the gym religiously in your 20s and you stopped going in your 30s and 40s because you became busy raising your children and you went back to the gym in the 50s, there's still muscle memories left, and it's very easy for you to rebuild that muscle mass. So if you've tried TMS and you come back for boosters, you can hope for remission much more quickly. Here we go. So The two top side effects that makes my patients stop medication, I don't know if Perry can add to this, but it's generally weight gain and sexual dysfunction. Male patients particularly don't tolerate sexual dysfunction. Nausea and constipation, diarrhea, people usually get better. Sedation, people usually get better. There's some blurry vision complaints, memory loss complaint, lots of dry mouth complaints, and some mild headache complaints. Whereas talk therapy and TMS really don't have any of these systemic side effects, only mild headache. You have to go see your therapist, so it takes time. You have to come do the TMS, so it takes time and it takes some investments. Here we go. All right, so the mild discomfort in the scalp and the transient mild headache, how do we tackle this? We make sure that you sleep more than 4 hours that night before you get the treatment, ideally 8 hours. We make sure that you're well hydrated. And then if that still bothers you, you can take Tylenol or Motrin before. So at this point, someone might ask, who should not get TMS? Anything that is MRI safe is TMS safe, but if you have a metal object like stent in your brain, the ferromagnetic metals can move around and non-ferromagnetic metals can heat up. So we would recommend that you don't do TMS. And if you have uncontrolled seizure disorder that you're not on medication for, then we should probably avoid it. Without the seizure history, it's really 1 out of 10,000 patients. It is less risk than taking immediate release Wellbutrin. It's a very, very small risk. If we ask like TMS technicians and psychiatrists, have you ever seen it? Like a long experienced psychiatrist and TMS technician will say maybe once in their long career. So it doesn't happen that often. In pregnancy, it's really not well studied, so we would avoid those pregnant patients. Um, let's talk about how does TMS feel like? Um, wait, hold on one sec. I'm going to take questions at the end. So um, it feels like woodpecker pecking on my brain. So it's usually left to right is how people feel it, or it's deep depending on the coil. I almost felt it in my nose and my teeth, some of them. But it's a train of rapid firing magnetic pulses, few seconds, and then you get a pause. It's generally comfortable. And then like after a while you get used to it. You barely notice it. It's not bad at all. Has anybody tried TMS in this talk? Anybody else can tell the whole group what it feels like?
So it's a little bit of tingling. Basically, it causes some skeletal muscle contraction. So some people are not used to that because we never really move the muscles on our head. But it's a feeling that some patients actually, once they get used to, they ask for you to increase it beyond what we're supposed to, and we just simply say we will not. But it's a little bit of tingling, a little bit of like a little tiny little zaps inside some areas in the brain, which usually are not really the areas that we're targeting. It's just that the feeling that the brain interprets may shift it to a side that it's not really where we are stimulating. And as I said, it's just simply a gym for the brain. It's the only way to really rejuvenate neuronal activity and get it back to where it's supposed to be. And because our brain changes over time, and those changes could be mild and very, very, it happens very slow. This kind of like pushes it back to where it was. It's kind of like going to the gym um, for a month to really put your body where it was, and at the end you realize, oh my God, I'm so much better. That's what most patients describe. And from depression perspective, just to refer to what you said before, yeah, the efficacy of drugs is quite low, and the STAR-D study that everybody refers to, which was a government study, was the largest ever done with 7,000 patients, that shows that the first drug you try, you have about a 33% success rate. By the second drug, it drops down to around 29. By the third, you're around 10% to 13%. And beyond that, again, you're at 13%. Meaning that when a doctor sees a patient who failed two drugs, he knows the chances that the next drug will help him is at best 1 out of 8, 1 out of 10. But they found that that study was fraudulent. And so the data was amplified by 100% more than what the reality is. So it's even worse than what I just said. And so again, it pushes you that deep TMS, which is non-invasive, non-medicinal, is by far a superior option. And from my experience, I've seen thousands of patients in my time in this space, and every single one that I've seen usually glows at the end. It's not just getting better; they literally are elated and happy, and it really causes you to be in a much better state.
Yeah, that's actually what we're seeing too. I'm quite excited to see that. It's premature to get so excited, but I'm excited to see that. Thank you for that. All right, so how long does it take? It's really 3 to 20 minutes, depending on the protocol. 3 minutes go by really fast. 20 minutes is with pauses in between, so it's pretty easy. Standard depression treatment is generally once a day for 5 days a week for 6 weeks, and a complete session is considered 30 sessions. There are accelerated protocols. I'm going to talk about them a little bit. The two protocols that I like the best are Saint protocol and Swift protocol. But if you're doing it like a boot camp as opposed to going to the gym every day, the intensive treatment should have tapered treatment, which is 6 treatments over 3 weeks. The Saint protocol. The SANE protocol stands for Stanford Accelerated Intelligent Neuromodulation Therapy. It just sounds so smart, right? Stanford Accelerated Intelligent Neuromodulation Therapy. But it's a protocol that's FDA cleared in September of 2022. It's an improved theta burst protocol with precision targeting. It has a lot more of a pulse dosing. So I guess if you compare that to medication, it's a stronger dose. And it has a robust clinical improvement result where even after 4 weeks after treatment was done, there's 52.5 reduction in the depression score compared to the sham group, which was 11% only. I think there's some clinics that actually does this same protocol, not over 5 days, but over 1 or 2 days as well. For people, busy corporate people who are traveling all the time, they can kind of cram it all in 1 or 2 days using Vyvanse or brain stimulants before treatment starts, which I haven't done, but it sounds really interesting. And when we do our second talk, I'll report back to you guys on how all of these turned out to be. All right, so what to expect? In week 1 or 2, there's subtle improvements, better sleep, increased energy, slightly brighter mood. What I hear the most is that I see the world with more colors. Things that I didn't notice is popping and like I'm noticing them more. Week 3 to 4, more significant symptom relief, feeling more hopeful, easier to manage daily tasks, whether it's dropping off our children or doing house chores or going to work on Monday, it just becomes a lot easier. Peak performance in the brain kind of comes at week 5 to 6 as the treatment is tapering down. And after the treatment, the durability of TMS is known to be anywhere from 6 to 12 months. In terms of how do we maximize treatment impact and like hold on to that durability, I think the longer duration of treatment is actually better. Yes, boot camp works if you cram it all in 1 or 2 days, but I think if you do it every day for 4 to 8 weeks, what I'm understanding is that it's slow and steady actually wins the race. Um, Obviously, increased pulse number in the treatment course gives you better outcomes, and outcome definitely depends on the stimulation parameter. So who's doing the treatment seems to matter. This is a graph that depicts after 20 sessions what happens to the response rate as well as the remission rate, deep TMS versus traditional TMS with medication and medication only. Response rate is at 66% for deep TMS, whereas just traditional figure 8 coil, it's 44, medication only is 23, and the remission rate is around 59, more than 1 out of 2 patients. Traditional TMS 42, less than 1 out of 2 patients, and medication only is at 11%. All right, there are factors that influences the timeline. Some people are going to have faster onset because we're just built differently. Some are more muscular. Some of us are more muscular, and some of us are more daintier. So there are biological factors of how your brain is formed or severity of depression when you started. That's going to make a difference. comorbidities like chronic pain or anxiety or PTSD or use of substances like alcohol and nicotine will influence how quickly you respond to TMS. Healthier the lifestyle, the better. That goes without saying. Proper nutrition, better sleep, more exercise, having community support, family support, friend support will make a difference. There are complementary therapies to TMS that can help augment the therapy. Yes, of course, psychotherapy and medication, but there's also integrative therapies like red light therapy, hypnotherapy, acupuncture that can accelerate the improvement. I do want to highlight here that mindset actually matters. So having realistic expectations can help you notice the little changes, little subtle changes better. Having a positive mindset can also help you to embrace and feel grateful that there are movement towards happiness, joy, wellness, all of that, better brain function. How do we measure it? It's PHQ-9, which is a validated depression questionnaire. If you are my patient, we do this like vital signs, so you've seen this before. There's GAD-7, which is a validated generalized anxiety disorder questionnaire. And then there's YBOC, which is Yale-Brown Obsessive Compulsive Scale. So we will be measuring this as your treatment progresses. And then the paradigm shift that I really want to sort of highlight is that we are an integrative medicine practice. And as Yvette highlighted, I kind of get my hands dirty on everything I think is going to help my patients. And I think TMS will be profound in uplifting the emotions, the thought process, and whatnot. So I'm hoping that TMS is beyond depression and the concept changes from mental disorder device to everybody device where we can feel happier and more joyful and live a smarter life that decreases neuroaging, dementia, and it increases our neuroplasticity as we start to live into our 90s and 100s. We are going to integrate TMS into our wellness model using hypnotherapy, red light therapy, hyperbaric chamber, and alpha stim that is already existing in our practice. And obviously, our fantastic health coach, Randy and Dana, will continue to do lifestyle medicine, nutrition, sleep, exercise, and reinforce healthy lifestyle. We do want to do 1 or 2 days of Saint protocol for those of you who are really busy, and then hoping that we can trigger rapid onset when somebody's really stuck using psychedelics like ketamine for faster onset, and then continuing the journey with TMS for durability of the response. So that's the paradigm shift that I'm hoping to do. We're going to end with Christina's story, which is a patient testimonial. So I'm going to play this video.
People are like anybody else. I have a million balls to juggle just like everyone does. It's just everything that you do is 10 times harder for a person that's depressed than it is for the average person. My depression, was it a serious issue in my life for me, for my family. It's very difficult, deep for family to deal with something that they can't see.
I met Tina on an inpatient at the inpatient facility here at Belmont a little more than 2 years ago. At that point, she described this very long 10-year history of depression with multiple episodes and culminating to that point where she had to be hospitalized.
I was over 10 years suffering and just on and off and on and off and never had any consistency. I just thought, you know what, I've tried everything. I've seen all these doctors. I think I really need, some major help. So that's when I came to Belmont originally to try see if I was a candidate for the ECT.
We know that that works very well, but she was a little concerned about how that might impact her going into nursing school, taking care of a young kid, managing her job, managing her married life and everything. With the anesthesia and everything, and this being a less invasive procedure without much hindrance to her lifestyle, we chose to do the deep TMS. We started her treatments somewhere in the beginning of January. She was able to get the 20 treatments, and she had a fabulous response.
I've been like incredibly well. By the third or fourth treatment, I'd bring a book and I would read. 2 weeks later, I was down on one medication. Another week later, I wasn't taking anything for sleep. And then I wasn't taking anything for pain. My attention level is so much better. You know, I get up, I make breakfast, I'm cooking again, I'm reading again. I have quality time with my family and I enjoy it. I'm a mother, I'm a professional, I'm a nurse. I am a wife.
This is the best I've seen her in more than 2 years. This is the best that her family has told me she's been ever since they've known her in the last 10 years.
Not even 2 months after starting this treatment that I'm in remission. And, you know, I'm so hopeful, you know, that this will help other people and that, you know, my remission will stay.
This has absolutely exceeded my expectations of what I was expecting the responses would be with the patients.
It's been like been amazing, like life changing.
All right. That's been typical in terms of testimonials that I've heard. So we are really excited. If there's any questions that people want to ask, now I'm going to open it up to the whole group so everybody can chime in and ask and answer. And I'm not the only expert here, so like feel free to chime in.
I have a question, Dr. Lee. Is there any evidence that this would also have some efficacy for issues with like motor function, motor cortex, movement, etc.?
Right. I think I mentioned it previously. I think for a post-stroke patients, I think it helps with like upper limb, mostly upper limb, but also lower limb spasms and movements. But it also is being used for Parkinsonism and Tourette's and like some motor stuff.
I
It's like,
can say that we had some significant improvement with post-stroke rehabilitation patients, and in general, because it revives neuronal activity in the brain, there's, I will say, an added side effect. So in other words, it kind of like moves beyond what you sometimes expect. So people who had issues with any kind of damage, motor activity, reviving the neurons and increasing plasticity of the brain will surprise you sometimes at how far it will take you.
So in treatment, I was thinking like Parkinson's and like tremors, RLS, that sort of thing. And then also I'm sort of maybe thinking a little ahead, but like the performance side of things, like, is this something like an athlete would want to use to like improve performance? Are we in that area yet with this technology where we can be thinking, okay, maybe you're fine, but you want to enhance
yeah, no,
function?
I could see it not necessarily like enhancing like the muscle, but enhancing your strategy or your grit in the game. Like if I do
Yeah.
it and I go play tennis and I win, I'll let you know.
Yeah.
Um,
Or golf, as the
yeah,
case
or
may
if
be.
my golf game suddenly
Yeah.
improves and I'm much
Yeah.
more focused, it
Mm,
definitely gives focus a boost. So I
Right.
could see the mental game of sports might improve with this.
Excellent.
If you're more concentrated, you can imagine any sports that requires like a fast response, and I think it's pretty much all of them.
Mm,
I believe should improve, and just like athletes do hyperbaric chambers to get better, I guarantee you that there's athletes, and I've heard of at least two who are inquiring about this, that they want to do it, they want to take it to their team and give their team treatments. One football team approached me back in 2019 asking for that.
excellent.
And I want to add one quick thing. There's another video. It's a video from, I believe, 2016 or 17 from UCSD, University of California in San Diego, with Dr. Feifel as one of the first adopters of Deep TMS. And there's a girl walking into his office. That's the first scene with brunette. And I think hearing her mom and her and their story is very, very touching and compelling. They've tried everything on the book, including old TMS, first generation TMS, and then then literally nothing worked, and then they shifted to Brainsway, and we hear that often. And you should simply just watch that because I think it's a very well put together story.
Yeah, YouTube is a flood of TMS miracle stories, so you could search that very easily. I want to invite all of you to our grand opening, Deep TMS Night, which is Thursday coming up, December 4th. It's a Thursday after Thanksgiving. It's an open house all day. Anybody can come and try it out if you want to like just experience it. It's 9 to 5, and then we'll have evening celebration. We'll have food and dinner and party and music. So everyone is welcomed, and whoever comes, we're going to give out like 50% off TMS treatment and gifts, and we'll have a lot of fun. Meet our team, meet Sarah, meet everybody. I think show up and we'll have a party. All right, I'm going to stop sharing my screen for now only because I kind of want to see who's here, and if Perry, if you have anything to add to this,
Yeah, I mean,
love to
I've
invite
treated,
you to,
do
yeah.
treat some. I was thinking when you're talking, I had somebody recently who showed great improvement with stuttering. He's like an elder gentleman. We were doing the standard depression treatment, but part of this was kind of treating his long-term stutterer since he was a child, and he showed great improvement with that. He was working with speech therapy as well, kind of concurrently. And too, like that's something I really encourage when people are doing some sort of psychotherapy or cognitive behavior therapy. I think is something that they're going to get more.
Wow. Wow.
I suggest stimulating the Broca areas. You may have a stronger effect.
Oh, there were some questions here that I didn't see before. For treatment-resistant depression, it's insurance approved, so insurance will reimburse. Um, I can't really speak much on insurance just because I don't take insurance. Perry, do you want to
I mean,
expand on that?
it's an approval process. You have to do a prior authorization. Each insurance company, they have their own specific prior authorization for each one of these, for TMS, and some are more lengthy than others. And so standards are you have to have trialed and failed different antidepressants, at least two, sometimes three, depends on the insurance companies, and also trialed and failed things like therapy. So I've it can be a lengthy process. Some insurances are more pro TMS. Cigna, for example, is probably the most pro TMS insurance company. They're the only ones that I've had approve OCD. Whereas everybody else, recently we got kind of a situation where somebody has co-occurring OCD and depression, and then I was documenting a lot about his OCD, and they denied it. I was able to kind of go back and get approval for the depression, but we're kind of actually treating his OCD, but you kind of have to stretch things a little bit to get approval, and push for depression. If somebody's coming to you, like I've had people come and say, well, I don't really want to take medication, but I wanted to just do something like this. The insurance is not going to approve it. You have to have trialed and failed medications within this most recent depressive episode. It can't even be like I took Prozac 20 years ago or something like that. It's really, they really are really stringent on, these certain things. But it is possible, but it's just a bit of a, depending on the insurance company and getting a provider, somebody that will take insurance, but also has to go through the process of working through it with you to get the approval for it.
Couple of comments, Perry. First of all, nice to see you.
Good to see you.
Quick things. One is Medicare. For those who don't know, Medicare does not require pre-authorization, so simply you can treat them right away if they fit the criteria. Some insurance companies require two, some one, some even zero, like no antidepressants need to be taken. Blue Cross Blue Shield of New York, for example, you don't need to do anything. other than just walk in. You don't even need to be majorly depressed. The form is very simple. But again, that's rarity. Cigna is definitely very good. Because we have the OCD coil and we've done the non-inferiority study, meaning that you can use the OCD coil to treat depression. If a patient is not approved for OCD, which, as he said, Cigna approves them, and I think Centene also does. But if a patient is not approved, Centene is actually through Fidelis. It's a very large population, managed Medicaid. But if you're not approved to get it through OCD and you can still appeal and ask it, it's probably better to get them approved for depression because you get more sessions. Depression sessions actually is 36. For OCD, you may get 29 or 35. So you get more sessions approved and you can use the OCD coil because it's non-inferiority and you treat both at the same time. So it's there's a lot of flexibility in ways out.
And
Can I ask a question?
sorry, go
Sure,
ahead.
Kristen.
Oh, thank you so much. Unless Perry, were you going to say something first?
Oh, just too that they, the when you get insurance approval too, some of them are like Magellan Insurance. They'll give you like the exact amount of days for treatment. So that means a person, has to come like pretty much on that schedule. And then every time you're going to run over, then you have to go get like authorization to extend. Like I had one woman, she has like 4 kids, young kids, and they were always getting sick. And I was like, I had to get like, keep on getting, they punted down the road, like 2 more weeks to get more time. So, we were able to do it eventually. I think we actually missed a couple at the end because they wouldn't give me the last one. But that's like another obstacle too, where it's like, if your schedule is really tight and things like that, they're more strict on the amount of days that they're going to give you to do it, kind of things like that.
Is it okay if I ask a question?
Go ahead, Kristen.
Yeah, sure.
So I'm just really fascinated by the way it works. And you may have already said it, but if you could just remind me, is it scanning the brain and looking to stimulate certain areas based upon what it's seeing? Or is it a standard procedure that happens that it just kind of runs through a program? Like, is it customized, I guess is my question. And would be the first question I have.
It's the latter. It's
Okay.
standard helmet, but it is customized in the way that the practitioner prescribes the protocol
Within what's happening, what's being, so
within the
it's,
parameter.
got it. Okay.
Brainsway in particular has an H1 helmet,
Mm-hmm.
and which is blue, and then an
Mhm.
H7 helmet and an H4 helmet.
Okay.
Blue helmet is for depression, yellow helmet is for OCD, so it's all standardized.
Okay.
Within the practitioner's experience and expertise, it can be individualized and protocoled.
Wonderful. Thank you. That really helps.
You're welcome.
I got a couple of questions.
Sure.
So I've been doing some searching online while you've been talking, and I also was finishing up my patient work, so I didn't hear everything. So I may have missed something, but I'm seeing that there could be applications for brain fog, for ADHD, and even for insomnia, which is pretty amazing and exciting since we see so many patients coming in with that. The question is, if somebody's going to respond, and of course everybody's different, but do you have any sense like maybe you're going to do 20, 30 sessions, but if somebody's going to respond, it doesn't start, the response doesn't start on the 30th session. Like, do you start seeing some response sooner than that? And the tag question is, if somebody responded, how likely is it that this is going to be a permanent response, or do you have relapses and then you retreat?
That's our beautiful Dr. Storch, who is in Jersey. He runs the Metabolic Institute. He's a very experienced functional medicine doctor who's been around the block for a very long time. So it's an astute question. I'm going to let Perry answer that, who has a more of an experience, clinical experience on TMS.
So you did mention sleep, which we do see a good number of people. It's a very common symptom of depression or depression anxiety, where people have trouble sleeping, difficulty falling asleep or waking. That's a pretty common, I'd say, depressive symptom or depression anxiety symptom, because quite often we get people not just depressed and anxious, or anxious depressed, kind of co-occurring. It's like they're tired all day, but then they can't sleep at night. So I'd say, I don't know the exact percentage, but it's a fair percentage. Like I've had people who are on these long-term sleep medications that are all of a sudden sleeping better. And that can happen. That's probably one of the first things that does remit. And it's not everybody, but it's probably around 50% of people see improvement in sleep. In terms of long-term durability, the percentages are relatively accurate. Around 60% of people receive remission. So you're talking, you're still getting the 4 out of the 40% that are remitting, and it's typically around a year. So I've done quite a few people retreating them with still success. They, some of the data suggests it's a little bit less effective like the second time or third time, but we have seen people that have had still positive response from doing it like 2, and I've got somebody even doing it a third time right now. But like I said too, the durability, like adding in additional factors like cognitive behavior, basically it's like if you go back to the same way of thinking and do things exactly the same, you're probably going to get more similar results in terms of all right, you've got the opportunity with the treatment, you have to kind of veer off the path and do things differently. And that's kind of the challenge for people. If you've been thinking the same way and doing this for a really long time, by yourself, it's going to be kind of like the same thing, where it's like, all right, with a good therapist, to kind of think about things in a different way is generally like the better way, I think, to get long-term durability, and adding in things like, better eating habits, exercise and things like this, like in the way that, Joon does all the functional medicines, because it's like we just focus on here and we don't include anything else. Your success rate is going to be much more limited. Just like, the old school method of giving somebody a statin, but they don't change lifestyle. It's not going to be that effective, right? So
Yeah,
the same too
Dr.
is that your brain is part of your body, right? It's part of everything. We have to treat it as a whole. That is just like your brain's up here by itself, unattached to everything else in your life.
Yeah, I agree with you so much, Perry. The whole taking people off medication is like music to my ears. And
Yeah.
having a sort of like electricity system to beat chemistry is also like a wonderful news. But one of the first things that actually comes is, I think, sleep. You sleep better and you wake up better. You wake up
Yeah.
with more energy, is what I hear. You wake up with more energy. You can pack kids' lunch a little bit easier, like Monday's a little bit easier. I slept better and I feel more energized, is what I hear.
Yeah, no, definitely. And homeostasis wise, right, if you take away sleep, people become, I mean, it's the biggest disruptor of mood and anxiety and just overall well-being. It's one of the biggest things, and if
Pain
you
too,
look at
right?
there's a sleep aisle in CVS that's like the whole aisle now. It's like nobody can sleep, So I mean, having something like this that's not a sedative, right? Where it's like we go to the sedative to stimulant, sedative, stimulant, we see this a lot in what we do, and it's not
America
maybe
has a
this is the
fight
way.
with sleep forever. Our kids don't go to sleep either, right? Us mothers, we know how hard it is to get the kids to go to sleep. We fight with them every day, but
Exactly.
brain is a habitual organ and a dynamic organ. What you practice more becomes much stronger. So practice, 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 practice makes best. So if you sleep better one night, two nights, three nights, four nights, five nights, then that becomes your norm. That becomes your alternate route of brain pathway that you've created.
So I have a question. Speaking of sleep, what if someone just comes in saying, I don't have OCD, I don't have any of these things, I'm just not sleeping? And certainly there could be something that's causing the sleep disruption. But what if it's not identified? Like, what would be the cap that they would use? Or,
Probably the depression cap is
okay.
yes.
Yeah, I mean the depression is like bar none, because I'm treating somebody from where like a neurocognitive, like a kind of like a dementia, and the standard protocol for that is we use the depression. We use that for depression, anxiety. Like so much is like the
Mhm.
prefrontal cortex.
Okay.
That has to do with so much
Stimulating
with
it.
brain function. Like I think
Mhm.
that the OCD one is used for OCD, PTSD. I'm not sure what else, because I've used it for the OCD one for somebody with PTSD. That's more off label. So, but the standard one, the main one, the depression anxiety one, I think we use more than anything else.
Okay. Thank you.
Kristen, I was sharing this with one of my female patients, but since I've tried TMS twice, I actually like my husband better. So it almost feels like it knocks some sense into me. It
Yeah.
was like knocking on my brain, and I think it could even like make relationships better. Like there's brain connections that fired up that sort of like made me see things a little bit differently, right?
Well,
So,
yeah, it sounds like it's unblocking things that might be getting in the way of our body doing what it naturally should be doing, which would be, say,
right,
connecting with a spouse or people or,
right.
expanding that window of tolerance so that we can actually see what's around us.
Right, like 25 years of marriage, you're kind of stuck, right? It
You
feels
kind of
like
get in patterns.
unstuck it, right? Like there's a way of
Yes.
differently looking at your spouse, like thinking about it and acting differently. That's what it felt like. It felt like it took me out of the congested highway and
Yes.
gave me new ways of thinking, like the new paradigm. That's why it's so profoundly befitting to my practice, which is called SeeBeyond, right? SeeBeyond medicine,
Mm.
see beyond like what you're kind of stuck at this time, whether that's a medical diagnosis or mental disorder, or just simply like you can't just get out of your own ways, right?
So expanding consciousness.
Right. So like it's been pretty profound. We've been loving it.
Wonderful. Thank you.
Any other questions? Any other comments? We're coming to an end. We're going to end on time. We started on time, I think. And then we'll end on time. So anybody else? Sarah, do you have something to say? Like, I don't know, I want to kind of hear from my staff too. Some of my staffs are here. I think all of my staff is here.
I mean, the staff that we have, like too, it's like the girls, or it's not typically girls, but they're going to work so much with people. You know what I mean? They're involved with their lives. Treatment, it's a lot of treatments in a row. You get to know your patients really well.
Hi, everyone.
Hi, from the
From the
PT
connected
office.
office. We just had a patient do TMS today, so it went perfect and we're having fun.
Yeah, Sarah has now treated depression, chronic tinnitus, PTSD. We've done OCD, and we're very excited to use it for like dementia prevention and just knocking some sense to everyone, helping them sleep, helping them feel better, and helping them find joy in their life.
Yep.
All right, thank you, everyone. You guys are all invited to December 4th open house, and we will see you there.
Thank
Thank
you.
you, guys.
Thank you, Dr. Lee.
Thank
Nice to meet
you.
everyone.
Bye now.